everyone. So I decided to make a Spanish flu video as an alternative to the video. Basically has a lot of the same information, but I just wanted the chance to reach out to you guys and kind of explain a couple of the things that were going on as we went through the information. And even if you did watch the video, I think that this will be a way to condense the information. So there you go. So the Spanish flu started ramping up in 1918. 1918 was an interesting time in our history because America had made incredible advances in technology and medicine. We had microscopes. We had developed vaccines for polio and rabies. And we were also participating in World War I. America had this culture and this feeling of invincibility, and that we were learning to kind of control life and death with our improvements in science and medicine. Unfortunately, in 1918, that all changed. The flu initially began traveling through military bases. So because the war was going on and there was a lot of movement, it quickly traveled throughout the world. Another issue with that is that people who were not sick, people who were asymptomatic but were infected, were able to spread the disease. And that's very similar to other viruses and to coronavirus today. So those are really important terms to remember. Asymptomatic, meaning not showing symptoms, and symptomatic, meaning that you are showing symptoms. Yeah, that's a huge issue. If someone's infected and they're walking around and they're spreading the disease and they're interacting with all these other members of the military, either on an international level or at home, that's a huge issue when we're talking about rates of infection. Let's go down. And also another issue was that because many doctors and nurses had been shipped out to Europe to support communities abroad, we didn't even have that many doctors to take care of people who were sick at home. So nurses were overworked. Playgrounds and parks were used for hospital overflow. We really didn't have the infrastructure or the support to deal with the amount of infections that were happening. And because we didn't really understand what kind of illness we were dealing with, doctors didn't know how to treat it. For a long time, they thought it was a bacterium. They tried to prescribe all sorts of weird treatments, including turpentine and sugar mixtures. So turpentine is what people use to remove paint. So not good stuff. And doctors felt helpless. They didn't know how to treat patients. And it was so significant that they just couldn't keep up. Another issue was in rural areas when infection started spreading to these rural areas. They found that within indigenous populations, there was a lot of trouble containing the spread using traditional Western techniques like distancing or using masks that they were using at the time, or having people contained in their homes. So indigenous populations were especially vulnerable. And the next section we talk about, when we focus on Alaska, we'll touch more on that. And you'll see just how bad it got. It was a really huge issue that has come to impact the culture and social structures of villages in Alaska today even. Another thing that made the Spanish flu particularly scary was that it was killing young people as well, people who were in the prime of their lives. They were 20 to 40 years old, which was scary for people because when we think of the flu, we think of vulnerable populations, people who have a pre-existing health condition. We think of people who are older. We think of people who are really, really young. That's what we're talking about when we say vulnerable populations. But this virus was not just attacking vulnerable populations. It was attacking strong, healthy people, and they were dying really quickly. Towards when things really reached their climax, in 1 month, the flu killed over 195,000 people in the U.S. And people along with medical institutions, society kind of just seemed to be falling apart. Schools were closing, farms were closing, children were orphaned. All the fabric, all the connections that keep us afloat and together as a society were, it just seemed like everything was eroding and going away. And even after the flu, people had a fear of intimacy. They had a fear of interacting in the way that they had before. The way you might be really used to hugging someone, they felt there was a distance between people because they were scared of one another. They were scared of getting infected. They were scared of spreading the disease. Because the people you care about the most were also the people that could also infect you. And it was a really hard place for people to be in. But later that winter, or later in the fall, as soon as it came into people's lives, it sort of mysteriously went away. After November 11th, which was armistice, our country was in a moment of celebration. At that moment, the virus seemed to be dissipating. It seemed like it just sort of ran out of people. That's one of the thoughts. And it finally seemed like our nation was rebuilding. And again, that was on November 11th. Another thing that we need to address when we're talking about all this is the memory of this event. And historically, it seems like as soon as people stopped dying, as soon as the event stopped happening right in front of people's eyes, people started to lose their memory of it. And this might have been a conscious thing. I could imagine if something that terrible was happening, I probably wouldn't want to think about it or talk about it or have it be part of my conversations and interactions with people. I would kind of want to start a new life. But I think the important part here, guys, is that these terrible things have a lot to be learned from. And the other important piece is knowing that our nation was in a really, really bad spot during the Spanish flu. But they did rebuild and they did come together and they recovered. So something to think about. And I'm not trying to scare you with all these videos. I want us to learn from these situations and I want us to learn from history. And so your task now is to draw connections between the Spanish flu and the coronavirus. And you can discuss those with a classmate. You can discuss those with a sibling or a family member. You can write them in the discussion board or as part of reading passage 1, or you can simply discuss it. And then when we come together on Thursday, be prepared to show what you learned. All right, bye.